The cough that won't let you sleep, the heavy chest that bothers you during the night, that unpleasant sensation of a stuffy nose that seems never to pass, are situations that many of us face frequently, especially after 50 years of age when the body begins to respond differently to the small discomforts of daily life. And in this scenario, a product that has probably been stored in your home cabinet for years may be being used in a completely mistaken way, wasting its real potential for relief and comfort, because the truth is that most people never learn to apply Vick VapoRub strategically, at the correct points, at the appropriate moment, and with the simple techniques that really make a difference. And this is not your fault, after all. This information is rarely shared in a clear and accessible way, but today you will discover exactly how to transform this classic ally into an effective tool to improve your breathing, reduce nighttime discomfort, and even contribute to more peaceful nights of sleep, all based on simple, safe practices supported by recognized health guidelines. So prepare yourself to understand how small changes in the way you use this product can directly impact your quality of life, your daily well-being, and your ability to rest adequately. Because when you learn to do things the right way, the results appear naturally and consistently, bringing real relief without complications or additional costs, and this knowledge can be applied immediately in your own home with safety and practicality. This content has an exclusively informative and educational character, does not replace consultation with qualified health professionals, and any doubt about persistent symptoms, respiratory conditions, or use of products should be clarified with your doctor, who is the most suitable person to evaluate your specific case and provide personalized guidance. Let's start with the basics, because we often think we know everything about a product we have been using for decades, but the reality is that the way we learn to apply Vick VapoRub, usually passed down from generation to generation, does not always reflect the best practices or the most effective methods. And this happens because popular knowledge, although valuable, does not always incorporate the most recent discoveries about how the body responds to certain stimuli, especially after 50 years of age when the skin becomes more sensitive. Circulation may be a bit slower, and the airways may need more attentive and strategic care, so when we talk about using Vick correctly, we are not suggesting anything revolutionary or complicated, but rather simple adjustments that respect the physiology of the mature body and take full advantage of the active components of the product, such as menthol, camphor, and eucalyptus oil, substances known for their calming properties, and that can help relieve the sensation of nasal congestion and respiratory discomfort when applied properly. And here is the central point. Proper application does not mean just spreading the product on the chest and waiting for it to work, but rather understanding where, when, and how to apply so that the effects are really felt, because the human body, especially with the passing of years, responds better to directed, consistent stimuli applied with attention. And this is exactly what we are going to explore now in a clear, direct way and without detours, so that you can incorporate these practices into your daily life without complication or doubt. One of the first points we need to address is the question of quantity, because there is a very common belief that the more product you use, the greater the effect will be. And this logic, although it seems to make sense at first glance, in practice can cause more discomfort than relief, especially on more mature skin, which tends to be more sensitive and reactive. So the general recommendation, supported by safe use guidelines for topical products, is that a thin layer, applied uniformly and strategically, is much more effective than a generous amount spread without criteria. Because what really matters is not the volume of product, but rather the way it is distributed and absorbed by the skin, allowing the vapors of menthol and daily life, especially for those who already have a history of respiratory sensitivity or frequent discomfort. And here it is important to reinforce that we are talking about light preventive use, not continuous and excessive application, because balance is always the key to any health practice. And the conscious and moderate use of products like Vick can bring benefits without causing unwanted effects. So if you notice that during certain periods of the year you tend to have more cough, congestion, or respiratory discomfort, consider incorporating Vick preventively into your routine, always observing how your body responds and adjusting the frequency and quantity as necessary. It is also essential to address the question of conscious breathing during and after the application of Vick, because many people apply the product and immediately return to their activities without paying attention to the way they are breathing, and this is an error that significantly reduces the effectiveness of the treatment, because the vapors of menthol and eucalyptus need to be inhaled properly to really take effect. So the recommendation is that right after applying Vick, you dedicate a few minutes to breathe deeply and consciously, inhaling slowly through the nose, holding the air for a few seconds, and exhaling through the mouth in a controlled way, repeating this cycle for at least 5 to 10 minutes, because this practice not only helps maximize the inhalation of vapors, but also promotes relaxation of the nervous system, reduces muscle tension, and prepares the body for deeper and more restorative rest. And this technique of conscious breathing is widely recommended by health and wellness professionals to promote emotional balance, reduce stress, and improve sleep quality. So by combining the application of Vick with this breathing practice, you are creating a complete care routine that goes far beyond simple symptom relief. You are investing in your integral health in a simple, accessible, and completely safe way. Let's talk now about the special care that should be taken, because although Vick VapoRub is considered a safe product when used correctly, there are situations in which its use should be avoided or done with extra attention. And this is especially important for adults over 50 years of age who may have underlying health conditions, more sensitive skin, or be using medications that may interact in some way with the components of the product. So the first recommendation is never to apply Vick on open wounds, irritated skin, or areas with burns, because this can cause pain, irritation, and even worsen the problem. And it is also important to avoid contact with the eyes, mucous membranes, and intimate areas, because menthol and camphor can cause intense burning and discomfort. So always wash your hands well after application and avoid touching your face or other sensitive areas. And if you have a history of skin allergies, sensitivity to menthol, or any other component of the product, it is essential to do a test before using it more widely, applying a small amount on the inner part of the arm and observing for at least 24 hours if there is any adverse reaction such as redness, itching, or swelling. And if this happens, suspend use immediately and talk to your doctor about alternatives more suitable for your case, because safety should always come first. And it is not worth taking unnecessary risks when there are other options available. Another point that deserves emphasis is the importance of keeping Vick VapoRub stored properly. Because many people store the product in inappropriate places, such as humid bathrooms, near heat sources, or exposed to direct sunlight. And this can compromise the quality and effectiveness of the product over time. So the recommendation is to keep Vick in a cool, dry place, protected from light, always with the lid tightly closed to prevent evaporation of active components. And it is also important to check the expiration date of the product before using it, because expired products may have reduced effectiveness or, in some cases, cause unnecessary irritations. So if that jar of Vick has been in your cabinet for years, it is worth checking the expiration date and, if necessary, replacing it with a new one, because saving a few dollars does not compensate for the risk of using a product that may no longer be in ideal conditions for use. And this is a general rule that applies to any health or wellness product you keep at home, because effectiveness and safety depend directly on the way these products are stored and preserved. Now let us bring a practical example to illustrate how these techniques can make a difference in real life. Because theory without practical application has little value, and the goal here is that you can visualize how to incorporate these changes into your daily life naturally and effectively. So imagine the situation of Martha, a retired teacher of 58 years who for months had been suffering from persistent nighttime coughs, stuffy nose, and difficulty having a truly restorative night's sleep. And she had already tried everything, from homemade teas to medications recommended by friends, but nothing seemed to solve the problem in a lasting way, until she decided to review the way she used Vick VapoRub, a product she always had at home but applied automatically, without paying much attention to details. So Martha began to make simple adjustments. She reduced the amount of product, started applying it at strategic points like chest, soles of feet, and nape of neck, always making gentle circular movements and dedicating a few minutes to breathe deeply and consciously right after application. And she also started using Vick preventively, applying a small amount before sleeping, even on days when she was not feeling intense symptoms, and the result was surprising. In less than a week, Martha noticed that nighttime coughs decreased significantly, the sensation of congestion reduced, and she started waking up more rested and energetic, and the most interesting thing is that she did nothing extraordinary. She just adjusted the way she used a product she always had at home, showing that small changes, when made consciously and consistently, can have real and significant impacts on quality of life. Another example is the case of Antonio, a 63-year-old accountant who worked long hours in closed environments with air conditioning and constantly felt that sensation of weight in the head, nasal congestion, and tension in the nape of the neck region. And he always thought that these symptoms were just part of the stressful work routine, something inevitable that he would have to endure. But after learning about the technique of applying Vick on the temples and nape of neck, combined with brief pauses to breathe deeply during the day, Antonio noticed a significant improvement in his well-being, and he began to incorporate this practice as part of his daily routine, applying a small amount of the product in the morning and at the end of the afternoon, always followed by a few minutes of conscious breathing. And this not only helped reduce the sensation of congestion, but also contributed to decreasing accumulated tension and improving his ability to concentrate throughout the day. And again, we are talking about simple, accessible adjustments that require no additional financial investment, just the willingness to experiment and observe how the body responds to these small changes. It is also important to talk about combining the use of Vick with other wellness practices that can enhance results, because no single product or technique is capable of solving all health problems. But when you combine different strategies intelligently and consistently, the effects add up and multiply. So in addition to using Vick correctly, consider incorporating habits such as keeping environments well ventilated, using air humidifiers during the driest months, drinking plenty of water throughout the day to keep mucous membranes hydrated, avoiding prolonged exposure to very cold air conditioning, maintaining a balanced diet rich in fruits and vegetables that provide important vitamins and minerals for immunity. Practicing light and regular physical activities such as walks, stretching, or yoga, which help improve circulation and respiratory capacity, and seeking moments of relaxation and adequate rest because the body needs time to recover and regenerate, especially after 50 years of age when cellular repair processes naturally become a bit slower. So by combining the correct use of Vick with these healthy lifestyle practices, you are creating a solid foundation to maintain your respiratory health and your general well-being in good condition, and this is much more effective than depending exclusively on any single product or technique. It is also worth noting that Vick VapoRub is not a universal solution for all respiratory problems, and there are situations in which symptoms indicate the need for professional medical evaluation, because persistent cough for more than 2 weeks, significant shortness of breath, wheezing in the chest, high fever, intense chest pain, or any other symptom that causes concern should be evaluated by a doctor, because they may indicate conditions that require specific treatment and should not be treated only with topical products. So although Vick can be an excellent ally for relief of mild and temporary discomfort related to common colds, nasal congestion, or occasional cough, it does not replace proper medical evaluation and follow-up, especially for those who have chronic conditions such as asthma, bronchitis, chronic obstructive pulmonary disease, or any other respiratory condition that requires specific care. So use Vick as a tool for comfort and symptomatic relief, but always maintain an open dialogue with your doctor about your symptoms, your self-care practices, and any changes you observe in your respiratory health, because the partnership between conscious personal care and professional follow-up is what really guarantees the best results in terms of health and quality of life. Now let's talk about the importance of observing your own body and adapting techniques according to your individual needs, because each person is unique, has a different health history, a particular sensitivity, and responds differently to external stimuli. So although the techniques we present here are based on safe and widely used practices, it is essential that you pay attention to how your body reacts to each of them and make adjustments as necessary. For example, if you notice that applying Vick on the temples causes any irritation or discomfort, stop this practice and focus only on the chest and feet areas. Or if you notice that application before sleeping works better for you than application in the morning, adjust your routine according to this observation. Because effective self-care is not about following rigid rules, but rather about developing a sensitivity to understand what works best for you, respecting your limits, your preferences, and your specific needs. And this capacity for self-knowledge and adaptation is one of the most valuable skills you can develop to maintain your health and well-being over the years, because no one knows your body better than yourself. And when you learn to pay attention to the signals it sends, it becomes much easier to make conscious and effective choices that really contribute to your quality of life. Another important aspect is consistency, because many people try a new technique for a day or two, don't see immediate results, and give up, returning to old habits that were no longer working. And this is a very common mistake that prevents people from really benefiting from practices that could make a difference, because the body needs time to adapt to new routines, and the effects of small changes generally accumulate over days or weeks, not hours. So if you decide to try the Vick application techniques we present here, give yourself at least a week of consistent practice before evaluating the results, because it is in this period that you will be able to notice if there really is improvement in the quality of your sleep, reduction of nighttime cough, relief of congestion, or any other benefit you are seeking. And consistency does not mean rigidity. You can adapt the routine according to your schedule and your needs, but it is important to maintain the practice regularly so that the effects really manifest. And this is a lesson that applies to any habit change you want to implement in your life, whether related to health, well-being, nutrition, or any other area. Because real transformation happens through conscious repetition and intelligent persistence, not through isolated or sporadic efforts. Eucalyptus to be released gradually, creating that sensation of freshness and relief that we all seek. And when you apply an excessive amount, what happens is that the product can accumulate on the skin, causing irritation, sticky sensation, and even hindering the absorption of active components. So the first adjustment you can make today is to reduce the quantity, focusing on the quality of application and not on the amount of product used, because less can really be more when we talk about topical products with action on the airways and skin. Now let's talk about the application points, which is where many people make mistakes without realizing it, because the natural tendency is to apply Vick only on the chest, in the central region, but the truth is that there are strategic areas of the body where application can be much more effective. And this has to do with the proximity of the airways, local circulation, and even the sensitivity of the skin in these regions. So the first area you should consider is the upper part of the chest, close to the base of the neck, where the skin is a bit thinner. And the vapors can be inhaled more easily, especially when you're lying down and breathing more deeply. And here comes a simple but very effective technique. When applying the product, make gentle circular movements without pressing too much, allowing the skin to absorb gradually and allowing you to inhale the vapors naturally, because deep and conscious breathing during application enhances the effect of the product, opening the airways and promoting that immediate sensation of relief that many seek. And this is not just a subjective sensation. Studies on aromatherapy and the use of essential oils, including menthol and eucalyptus, indicate that inhalation of these substances can help reduce the sensation of nasal congestion and promote more comfortable breathing. So when you combine topical application with conscious breathing, you are maximizing the benefits of the product in a natural and safe way. Another application point that deserves special attention is the soles of the feet. And here many people raise their eyebrows because it seems strange or even ineffective. But the truth is that this technique has been used for many years, and there is a plausible explanation based on reflexology and the stimulation of nerve points that may be connected to the airways. So the idea is to apply a small amount of Vick on the soles of the feet, massage gently, and then put on clean socks before sleeping. Because the heat generated by the feet during the night helps release the vapors of the product, which can be inhaled indirectly and contribute to a more peaceful night with less coughing and greater respiratory comfort. And although the exact mechanisms of this technique are still the subject of discussion among experts, many people's reports indicate that this practice can bring significant relief, especially in cases of persistent nighttime cough. And the good news is that this application is completely safe, does not cause irritation in most cases, and can be easily incorporated into the nighttime routine. So if you have never tried it, it is worth experimenting and observing how your body responds, always remembering that each person is unique and what works for some may have different effects on others. But the safety and simplicity of this technique make it a valid option for those seeking natural and accessible alternatives to improve respiratory comfort during the night. Now let's address an application that many people are unaware of, but that can be extremely useful for those who suffer from muscle tension, headaches related to nasal congestion, or simply that sensation of weight in the forehead and temple region, which is common when we have colds or are in very dry environments. And the technique consists of applying a very small amount of Vick on the temples and nape of the neck, doing a light circular massage without pressing too much, just enough for the product to be absorbed and the vapors to be inhaled. Because the menthol present in Vick has properties that can help relax the local musculature, improve superficial circulation, and promote a sensation of freshness that many describe as immediately calming. And here it is important to reinforce that this application should be done carefully, avoiding contact with the eyes and mucous membranes, and always washing your hands immediately after use, because facial skin is more sensitive and requires extra attention. But when done correctly, this technique can be a valuable ally to relieve discomfort related to nasal congestion and tension accumulated throughout the day, especially for those who spend many hours in closed environments with air conditioning or little ventilation, situations increasingly common in the routine of many adults over 50 years of age who still maintain an active and professional life. It is also essential to talk about the timing of application, because many people use Vick in a hurried way, right before leaving home or minutes before sleeping, without giving time for the product to really take effect. And this is an error that significantly compromises the results, because the effectiveness of Vick VapoRub is directly related to the contact time with the skin, the room temperature, and the way you breathe after application. So the ideal is to apply the product at least 15 to 20 minutes before going to bed in a slightly warm and comfortable environment, allowing you to relax, breathe deeply and consciously, and allow the vapors of menthol and eucalyptus to be inhaled gradually. Because this combination of factors creates the ideal conditions for the product to exert its calming and decongestant effect. And here comes a practical tip that few consider when applying Vick before sleeping. Keep the head of the bed slightly elevated, using an extra pillow if necessary, because this position facilitates drainage of the airways, reduces the sensation of congestion, and contributes to a more peaceful night's sleep. And this guidance is consistent with general recommendations from health professionals for those who suffer from nighttime respiratory discomfort. So you are combining the correct use of the product with postural practices that enhance relief, creating a really effective and comfortable nighttime routine. Another important aspect that deserves attention is the interaction of Vick with heat and humidity, because many people do not know that taking a warm or hot bath right after applying the product, or even applying it during the bath, can significantly intensify the release of vapors and promote an even greater sensation of relief. And this happens because the heat of the water and the steam from the bath help open the pores of the skin, facilitate the absorption of active components, and create a natural aromatherapy environment where the vapors of menthol and eucalyptus are inhaled in a more intense and concentrated way. So a simple technique that you can incorporate into your routine is to apply a small amount of Vick on the chest or feet before entering the shower, allowing the heat of the bath to enhance the effect, or apply it right after the bath when the skin is still slightly moist and warm. Because at this moment, absorption is facilitated and the vapors are released more efficiently. And this practice can be especially useful during the colder months of the year, when the tendency is to take hotter and longer baths, creating a perfect opportunity to transform a moment of daily hygiene into a session of respiratory care and relaxation, without needing special equipment or additional products, just intelligently taking advantage of the resources you already have at home. Now let's talk about prevention, because many people only remember Vick when they already have established symptoms. But the truth is that this product can be used preventively, especially in periods of greater vulnerability such as seasonal changes, very dry days, exposure to environments with intense air conditioning, or contact with many people in closed places. And the logic here is simple. By applying Vick lightly and strategically before leaving home or before sleeping, you create an aromatic barrier that can help keep the airways more comfortable and less susceptible to irritations. And although this does not replace basic hygiene measures such as washing hands, avoiding crowds when possible, and keeping environments ventilated, it can be an additional layer of comfort that makes a difference in. It is also essential to mention that the use of Vick VapoRub, as effective as it may be when done correctly, does not eliminate the need to maintain basic hygiene and respiratory disease prevention practices. Because we live in a world where we are constantly exposed to viruses, bacteria, and other agents that can compromise our respiratory health, so it is essential to wash hands frequently, especially before touching the face. Avoid close contact with people who are clearly sick. Keep environments well ventilated and clean. Avoid sharing personal objects such as towels and cups. And if you have symptoms of a cold or flu, take measures to avoid transmitting to other people, such as covering your mouth when coughing or sneezing properly, discarding used tissues, and if possible, avoiding crowds until symptoms improve, because these basic hygiene practices are the first line of defense against respiratory diseases. And Vick should be seen as a complement for symptom relief, not as a substitute for these fundamental preventive measures. And this understanding is essential for you to maintain a balanced and realistic approach to caring for your respiratory health. Now we arrive at the point where it is important to consolidate everything that has been discussed and transform this knowledge into practical action, because information without application has little value. And the goal of all this content is that you really incorporate these techniques into your routine and notice concrete improvements in your well-being. So let's recap the main points. Objectively, use a small amount of Vick VapoRub, applying in thin layers at strategic points such as the upper part of the chest, soles of feet, and if desired on the temples and nape of neck, always with gentle circular movements and without excesses. Apply the product at least 15 to 20 minutes before sleeping. In a comfortable and warm environment, dedicate a few minutes to breathe deeply and consciously after application, inhaling the vapors through the nose and exhaling through the mouth in a controlled way. Keep the head of the bed slightly elevated to facilitate breathing during the night. Consider applying Vick on the feet with clean socks before sleeping to enhance the effect. Try combining application with warm or hot baths to intensify the release of vapors. Use the product preventively during periods of greater vulnerability such as seasonal changes or very dry days. Store Vick in a cool, dry place, always checking the expiration date before use. Observe how your body responds and adjust techniques according to your individual needs. Maintain the practice consistently for at least a week before evaluating results, and never use the product on open wounds, irritated skin, or sensitive areas, always washing your hands after application. And if symptoms persist for more than 2 weeks or worsen, seek professional medical guidance for proper evaluation. Because these are the basic guidelines that will allow you to use Vick VapoRub safely, effectively, and really beneficially for your respiratory health and your general well-being. This content was developed based on safe use practices for topical products, general guidelines on respiratory care, and information available from recognized health sources. But it is important to reinforce that it has an exclusively informative and educational character, does not replace medical consultation or professional treatment, and any doubt about symptoms. Specific health conditions or use of products should be clarified directly with your doctor or qualified health professional, who is the most suitable person to evaluate your individual case and provide personalized guidance. So use this information as a practical guide to improve your self-care, but always maintaining open dialogue with the professionals who monitor your health, because this is the safest and most effective approach to guarantee your long-term well-being. Let's now delve a little deeper into the relationship between the correct use of Vick and sleep quality, because this is an aspect that directly affects the lives of millions of adults over 50 years of age. And often nighttime respiratory discomfort is one of the main culprits for poorly slept nights, daytime fatigue, and that sensation that the body never rests completely. And when you manage to improve breathing during the night, even if subtly, the impact on sleep quality can be significant, because restorative sleep depends on various factors, including the ability to breathe comfortably and without interruptions. And this is where the role of Vick comes in when used correctly. Because by applying the product at strategic points before sleeping, combined with conscious breathing techniques and proper positioning of the headboard, you are creating more favorable conditions for your body to relax and enter a state of deep rest. And this does not happen by magic, but rather because you are reducing the factors that cause discomfort and interrupt sleep, such as the sensation of stuffy nose, irritative cough, or that sensation of weight in the chest that many people experience during the night, especially in colder or drier periods of the year. So by properly caring for your breathing, you are directly investing in the quality of your sleep and consequently in your general health, because sleep is one of the fundamental pillars of well-being, and without it, all other areas of life tend to be negatively affected. It is also interesting to note that the aroma of Vick VapoRub, with its notes of menthol and eucalyptus, can have a positive psychological effect for many people because these aromas are frequently associated with sensations of cleanliness, freshness, and care. And when you inhale these vapors before sleeping, you may also be activating positive memories of care and welcoming, perhaps related to childhood, or moments when you were cared for by someone during a period of illness. And although this aspect is more subjective and difficult to measure scientifically, we cannot ignore the fact that sensory experiences have a real impact on our emotional and physical state. And when you feel cared for, comfortable, and safe, your body naturally relaxes and allows itself to rest more deeply. So the correct use of Vick can bring benefits that go beyond simple physical relief of respiratory symptoms, also creating an emotional environment more conducive to relaxation and rest. And this is especially important for adults over 50 years of age, who often carry tensions accumulated over decades and can benefit enormously from simple practices that promote integral relaxation, body and mind. Another point that deserves to be explored in more depth is the relationship between hydration and the effectiveness of Vick VapoRub, because many people don't make this connection. But the truth is that adequate hydration of the body and airways is fundamental for topical products like Vick to function optimally. Because when you are dehydrated, the mucous membranes of the airways become drier. And more irritated, the skin absorbs less of the active components and the body as a whole becomes less responsive to external stimuli, so a simple but extremely effective practice is to increase water intake throughout the day, especially a few hours before sleeping, because this will keep your mucous membranes hydrated and facilitate the action of Vick vapors during the night. And here we are not talking about drinking large amounts of liquid immediately before sleeping, which could interrupt sleep for bathroom trips, but rather maintaining consistent hydration throughout the day. Drinking small amounts of water frequently, and this is a recommendation that is aligned with general health guidelines from organizations such as the World Health Organization, which highlights the importance of adequate hydration to keep all body functions operating optimally, including respiratory health, blood circulation, and cellular regeneration capacity. So when you combine the correct use of Vick with adequate hydration, you are maximizing the chances of obtaining really significant results. Let's also talk about the importance of creating a nighttime ritual that incorporates the use of Vick as part of a broader sleep preparation routine. Because the human body responds very well to consistent routines, and when you establish a sequence of actions that you always perform before sleeping, you are sending clear signals to your organism that it is time to relax and prepare for rest. So consider creating a ritual that includes activities such as reducing ambient lighting, turning off electronic devices at least 30 minutes before sleeping, taking a warm bath, applying Vick at strategic points, practicing a few minutes of conscious breathing, reading something light and relaxing, or listening to soft music, and then lying down in a comfortable position with the headboard slightly elevated. Because this sequence of actions, when repeated consistently, will condition your body to recognize that it is time to sleep, facilitating the relaxation process and significantly improving the quality of your sleep. And here Vick ceases to be just an isolated product and becomes part of an integrated sleep care strategy, which is one of the most neglected but also most important areas of health, especially after 50 years of age, when sleep quality tends to be naturally affected by hormonal changes, alterations in circadian rhythm, and other issues related to the natural aging of the body. It is also essential to address the question of room temperature, because this is a factor that many people ignore, but that has a direct impact on the effectiveness of Vick and sleep quality, because very cold environments can cause the product to harden and not release vapors properly, while very hot environments can cause discomfort and hinder relaxation. So the ideal temperature for sleeping, according to sleep quality studies, is generally between 16 and 20 degrees Celsius. And this range is also ideal for Vick to function optimally, releasing vapors gradually and constantly throughout the night. So if possible, adjust the temperature of your room to this range, using fans, air conditioning, or heaters as necessary. And if you don't have precise control over temperature, at least make sure that the environment is not excessively hot or cold, and use bedding appropriate for the season, because all these small adjustments added together make a significant difference in the quality of your sleep and in the effectiveness of Vick VapoRub use. Another aspect worth exploring is the difference between topical use and inhalation, because although Vick is primarily a topical application product, much of its effect comes from inhalation of the vapors it releases, and many people don't understand this distinction. So they apply the product but don't pay attention to the way they are breathing, which significantly reduces the benefits, because the menthol, camphor, and eucalyptus oil present in Vick exert their decongestant effect mainly when inhaled, coming into contact with the mucous membranes of the upper airways. So topical application works as a vehicle to release these vapors in a controlled and prolonged way, but it is inhalation that really brings relief from congestion and improvement in breathing, which is why it is so important that you dedicate a few minutes after application to breathe consciously and deeply, because it is at this moment that you are maximizing the contact of vapors with your airways. And this understanding of the difference between topical application and inhalation will help you use the product much more effectively, focusing not only on where to apply, but also on how to breathe after application, because both aspects are equally important to obtain the best results. Let's now address a question that many people have doubts about but rarely ask, which is whether there is a daily use limit for Vick VapoRub, and the answer is yes, it is advisable to use the product in moderation, generally no more than 3 applications per day and always respecting intervals of at least 4 to 6 hours between each application, because excessive use can cause skin irritation, sensitization to active components, and even reduce the effectiveness of the product because your body can become accustomed to stimuli when they are too frequent or intense. So the general recommendation is to use Vick strategically, applying mainly before sleeping, which is when you will have more time to enjoy the effects, and eventually during the day if there is significant discomfort, but always with moderation and attention to the signals of your body. Because if you notice any type of irritation, persistent redness, itching, or discomfort that does not improve after a few hours, it is important to suspend use and give time for the skin to recover. And if necessary, consult a doctor or pharmacist for guidance on alternatives more suitable for your specific case. Because safety should always be a priority, and no product, however safe it may be when used correctly, is free from causing adverse reactions in some people. So always use with common sense and attention. It is also important to talk about the interaction of Vick with other products or medications you may be using, because although Vick is for topical use and generally does not cause significant systemic interactions, there are situations in which it is important to be cautious. For example, if you're using other creams, ointments, or topical medications in the same region where you plan to apply Vick, it is advisable to wait at least 2 hours between applications to prevent products from interfering with each other or causing irritation. And if you're taking oral medications for respiratory cardiac problems or any other condition, it is always prudent to inform your doctor about all the products you're using, including over-the-counter products like Vick, because although the chances of interaction are low, your doctor needs to have a complete view of everything you're doing to care for your health. And this allows them to provide more precise and personalized guidance, especially if you have complex health conditions or use multiple medications, a common situation in adults over 50 years of age. So always maintain open and honest communication with your health professionals about all the self-care practices you adopt, because this transparency is fundamental to guarantee your safety and optimize the results of any treatment or intervention you're undergoing. Another point that deserves emphasis is the question of using Vick in different seasons of the year, because the body's needs change according to climatic conditions, and adapting the use of the product to these variations can significantly increase its effectiveness, for example, during winter when the air tends to be drier and colder. The airways naturally become more irritated and sensitive, so preventive use of Vick can be particularly useful in this period, applying small amounts before leaving home or before sleeping to keep the airways more comfortable. Whereas during summer, when humidity is generally higher and temperatures more elevated, use can be more sporadic, focusing mainly on moments of real discomfort or in environments with very cold air conditioning, which can also dry out the airways. And in spring and autumn, when temperature changes are more frequent and abrupt, strategic use of Vick can help the body adapt better to these variations, reducing susceptibility to respiratory discomfort, typical of these transition seasons. So observing the calendar and adapting your self-care practices according to the seasons is an intelligent way to maintain your well-being throughout the year. And Vick can be a useful tool in this seasonal adaptation as long as it is used consciously and appropriately for each context. Let us also talk about the importance of maintaining realistic expectations regarding what Vick VapoRub can and cannot do. Because although it is a useful and effective product for relieving mild respiratory discomfort, it is not a magic solution that will solve all health problems. And having this clarity is fundamental to avoid unnecessary frustration. So Vick can help relieve the sensation of nasal congestion, reduce irritative cough, promote a sensation of respiratory comfort, and contribute to more peaceful nights of sleep, but it does not cure infections. Does not treat underlying causes of chronic respiratory problems, and does not replace necessary medical treatments for more serious conditions. So use the product as a comfort and symptomatic relief tool, but always within a broader context of healthcare that includes adequate nutrition, hydration, physical activity, regular medical follow-up, and all the other practices that you know are important to keep your body functioning well. Because health is always a combination of multiple factors, and no single product, however good it may be, can